Welcome to Season 12 of the Prosthetics and Orthotics Podcast. This is where we connect with experts in the field, patients who use these devices, physical therapists, and the vendors who help bring it all together. Our mission remains the same, to share stories, tips, and insights that help improve patient outcomes. Tune in and join the conversation. We're glad you're here and hope it's the highlight of your day.
Hello everyone, my name is Joris Peels, and this is another episode of the Prosthetics and Orthotics Podcast with Brent Wright. How you doing, Brent?
Hey, Joris. I'm doing well. It's the close of a new year.
Okay.
Or an old year. However you want to look at it. It's the close of it. So I wanted to take we foreshadowed a couple episodes that we were going to take a look at how L codes get their pricing and what the benefits and or pitfalls are if you go through all the work and what it means when it doesn't work out. So I'd like to jump into that a little bit.
So it seems very simple, right?
Yeah. Yes.
But it isn't. Your tone just tells me this is not going to be simple.
Well, if you're looking at just common sense stuff, it's like, okay, if we're doing something good for people and it doesn't exist and we start getting some data, we show the data, it's definitely better. So I'm thinking like the point designs type of thing. We collect years and years worth of data, and then we say, hey, this is different enough. We want to go for an L code. And, you would want the process not necessarily to be easy, but there's a slight barrier to entry. But you would think that maybe you would use some common sense in this and really take a look at the product for what it is, what the benefits of it is, and then not reward the people that do it, but you reward innovation. Like if it's a good innovation, it's making a difference for patient, it's a cost effective, you see patients doing better with it, then maybe you give a good reimbursement for that, or a reasonable reimbursement. And that is not what we've seen on this last kind of go around with, there's two products that I'm specifically talking about, and that's the Point Designs digits, and then the other is a product from Ethnocare. They're not based out of the US, but you remember those Reebok shoes where you pump them up and it kind of fills the air bladders? They do the same sort of thing, but you and I have talked that patients have variability in their size throughout the day, fluid retention or such. And so they have this kind of sock sleeve sort of thing that you pump up rather than keep on putting on socks. Like take your prosthesis on, put another sock on because you're getting smaller. You can literally
seems
just
convenient, actually.
Yeah.
And you could presumably do this with like one hand or something, or
Correct.
Okay.
So
that seems like a lot of convenience if you're at the office or if you're wearing a suit or whatever.
Yeah. So I would say both of these companies in the US, we would say, got hosed for their decision to pursue an L code.
Okay. So talk to me first about the situation. What happens if I don't pursue this L code? Then I can't get reimbursement at all, or I have to sell everything commercially? How does that work?
Yeah, so there is what's called miscellaneous codes, and miscellaneous codes are really a pain to bill, but you can get reimbursed for miscellaneous codes. So, but you have to have good descriptors, and then you have to work with customers, like clinicians like myself or other companies, both large and small, to be willing to put up with the aggravation of submitting a 99 code. So if you submit a 99 code, which is called a miscellaneous code, then it goes through multiple levels of appeal, back and forth, pricing. And then when they finally say that they have approved it and you go to bill it, they can still deny it and not pay it.
Wow. Okay.
So that's how you can still be in the market, and you find people that are, say, like-minded or whatever, that are willing to put up with that. And then the reward is great enough that they'll put up with it, and then they get billed on the other side of it. A lot of companies want clarity for the clinicians, and even people like myself, like those 99 codes really slow down our billing team, and our team's time is actually better off doing other things rather than trying to pursue getting paid for 99 codes. So it's really only in ultra rare cases that we will take on a project or a client that requires those kind of devices, because the paperwork is so steep and the risk is still there that you won't get paid at the end, and then you have to fight and fight and fight for it. And so just for instance, and this is part of the reason why the US healthcare system is so broken. So let's just say you spent 6 to 9 months getting an authorization for, let's call it a point digit 599 code. So you go through all the cost and expense of doing that. You actually go through the cost and expense of providing the device. You go and you provide the device, and then you bill it, and then the insurance denies it, saying that it's experimental or whatever after they've approved it. So then now you're out like all that time. Now true money of the cost of the device. Now you're going to have your billing people again go in and fight. And if they don't pay, then they have what they call the ALJ, which is the final decision maker of it. It's typically some sort of medical judge, and they look at both sides. So they look at the side of the insurance company, your side. And I would say most of the time when you get to that level, if you have your documentation in place, you're going to win, and then the insurance will then pay. But that process can be a year or more.
Oh, wow. That's just
so you have all this money tied up. And then I just talked to somebody that won an ALJ and then still lost. So we thought that the ALJ was like the pinnacle. Like if you win there, you're done. But apparently there's still one more level where somebody can appeal, or the insurance company can appeal and overturn that. And then that's the end. Like you have no other options. I'm just saying, so if you were in, say, my position, would you want
couldn't
to
really do this a lot, and you couldn't do it on really expensive things, essentially.
And that's the thing, is typically it's a lot and an expensive thing.
Okay. And normally the other way, if I don't have an L code, it doesn't get reimbursed at all. Apart from that, really, the process that can be super laborious. But you mentioned that these companies kind of got shafted. No, I'm allowed to say hosed.
Yeah.
What do you mean by that? Explain the cases just for people that didn't have. So these Ethnocare have I think the weird thing is I'm trying to empathize with the insurer and all these other people. A lot of products, I think, you probably maybe don't understand, right? Or you maybe don't get it, or maybe it's too gimmicky or too robot-y, or it's like $50K or something.
Right.
So I understand. There's some myoelectric eyebrow, I don't know, something like new, right?
Right.
I can understand they would be really kind of pushing back on that. But both these products don't seem super crazy, in the scheme of things.
No, I mean, and so that's the thing with this. Both products fulfill a real patient need. I think when we had Chris Baschik on, and then when we had goodness, his name is escaping me, but he's a user of the man, and he'll kill me. I'm going to have to edit that out. Jeff Solberg. We had him on. And partial finger amputation makes up the largest portion of amputations, and it's the most underserved out of everybody. And it's the most useful. Think about how much you use your hands, and if you don't have a thumb or a first digit, that's a problem that gets in the way. So like they're filling a real need, and then you've got the Ethnocare group that is fulfilling a real need. Up to it's almost the same thing as wearing up to like 15 ply of socks. So you don't have to carry around a purse or a merce, right? The man purse full of socks if you fluctuate in volume throughout the day. So you think that would be a
but
really
also just the
good
conveniences, right? Like just like imagine
100%.
You're at the office, you have to go to the bathroom, kind of get partially half undressed or something, and then maybe later you have to do it again, and then you have a meeting, and you know what I mean? Just the getting in the way of just life in general is really annoying as well.
Yeah. So here's what happened with the Point Designs project. They have multiple ways that there's two main ways. They call it a crosswalk and then a gap. And I can go through that shortly. But they, on this particular case, said, okay, so there's a mechanical hand and we already have a code for that. And so a point design's finger is just 1/5 of a mechanical hand. And so we're just going to take our current reimbursement and just divide it by 5, and that's the reimbursement for point designs.
Okay, but that's a really, as a heuristic goes, that's not bad. There's a certain logic to it.
That
But the logic is kind of based on the idea like, let's not spend too much money, right? And of course it would mean that if your hand is the one finger would mean that one finger, like the 5 fingers individually, would be the same cost as the final device, which is of course really weird, and of course is not going to happen.
Right. And it's just different. The product is different.
Oh goodness. So there's no economies of scale doing a hand. I could just buy the finger separately or something, or there's no integration.
Right. It has no mention of, say, the socket stuff, the ratcheting aspects, how much it holds, that sort of thing. There's none of that.
And is this expensive? Is there just like super expensive? I know they're made using like one click, other LPBF. It could be kind of expensive, the lightweight and all this. Are these things way more expensive than alternatives that are already on the market, or not really? Or
there's really not an alternative. So I don't know the actual cost because I've actually never fit a point design. I've made a few of them, but I've never fit them. But I want to say it's somewhere in the neighborhood of like $4,000 to $6,000 per digit is what these things.
This sounds expensive to me, but okay.
Well, when you're talking about titanium LPBF, I mean, it's pretty. Those things are, it's not insignificant, all the ways to do it. So, but you're right. I mean, so that does sound expensive, but then when you take a look at all the things that can potentially go wrong, you've got to be FDA approved. You have to have your ISO certifications. You've got to have insurance if somebody is using this thing going ziplining and for whatever a finger breaks and they fall. Like, just, you have to plan for the most ridiculous things, and that person, if they get hurt, they're probably going to come back, and that the U.S. is a litigious country. And so now you've got to carry this ridiculous insurance because sometimes people do ridiculous things. And so that's a lot of where this expense comes in, is that layer of how do we protect ourselves from lawsuits, which is a terrible way to run a business. But
so this thing is, and now with this 1/6 of the 5 of the hand thing, they would get reimbursed like $300 or whatever, right?
Yeah. So it's like $280. And so, and this is the interesting thing. So I think, and this is probably a time that we give our, what do we say? We are not experts in L codes. We are not lawyers. You're just
Please don't sue me. I have no money.
Two people discussing this, trying to make the most of it. So, but what's interesting is, so they chose to use, there's 2 ways to create pricing. One is called the crosswalk way, and then the other is the gap fill way. So the crosswalk way is, hey, there's already something similar on the market, and we're just going to go with that L code and just divide it by 5. And so essentially they're saying there's something similar. So we just kind of lick our finger, put it in the air, and we're going to say, here's the price. The other way, which could be a combination, I'm not sure, is this gap fill. So what they do is they'll take a look at invoices. They'll look at MSRPs, wholesale prices, any retail catalogs, manufacturing costs, and then fee schedule history for other things, so like socks. So here is where I think the Ethnocare side of thing kind of went sideways. When you have a new product, you want people to use it. And so what do? You price it in such a way to get people to use it.
Sure, yeah.
Right?
Margins aren't really important in the beginning. You want feedback as well. Right?
You want feedback. You want people to try different people. You want to get
athletes, tall people, whatever. Yep.
Utilization, that sort of thing. But this is where things can go sideways quickly, because if during their research they find that let's say it's $1,000 product, and I have no idea how much it is, and you sold it to somebody for $300. Well, there's your new ceiling, because you sold it to them for $300 because you're trying to get utilization. So I believe this is what happened, is that because Ethnocare had been around for a while, trying to get this utilization up, there were some invoices probably floating around that made it into their hands. And they're like, well, really, it shouldn't be $1,000. It should be $300 because that's what they're already charging for people. In fact, we're probably not going to do $300, and I don't know what the final number is for them. But here's the other funny
I checked
thing.
on the website, and the pricing is like well, in euros it's like 700 and 900 euros, something like this.
Okay, so roughly $1,000.
Crazy expensive given the utility, right?
Right. So, but here's,
although I don't know how long they last, right? So
yeah, and nor do I. I don't know much about them. So, but here's the other interesting thing is at least from some of these meetings apparently. So they say, okay, it'll take up 15 socks. So how much does 15 socks cost? About $300 too. So now they're saying, well, 15 socks, cost about $300. And hey, you invoice somebody for $300. So that's just what the price is going to be because that's what it is. And so you have this company that's trying to do the right thing, trying to get utilization that gets burned by just trying to cover some of their costs, and some of these invoices make it out into the public, and then there you go. So it's a really tough thing.
But again, I'm trying to be empathy for the other side here and devil's advocate, I guess. And it is really difficult to do stuff like this. I've done this stuff where we're trying to figure out like a pricing or try to figure out a market for a startup and pricing. And it's a really difficult thing to do. So substitution type pricing, what is the value? What is the value for different people? Do you want market share or do you want margin? There is a lot of stuff going on there. If you're really trying to do something innovative to get a right price, it's very, very difficult. But having said that, this does kind of like seem to deter people from being innovative. But what option do these guys have now? So what's the thing? They can appeal as well or not?
Man, I don't know where Ethnocare is. So this is the danger, right? So once you have a code and you have pricing, the companies, like I can no longer use a 99 code. Because now they explicitly have a code.
So there's no point,
So now I go from the potential of, say, a Point Designs of $6,000. I can't bill $6,000 anymore because there is a code with a price that says it's $280 or whatever it is, $300. And so it's a really tough position to be in. Now they do have, and I think it's coming up in January, the ability to appeal. I can't imagine a time where, they set an anchor like that, $280, and say, it's just $6,000. There's a lot of space in between. And I just, how are you going to close the gap? I don't know, man.
And are there like super specialized lawyers for this, or would you have to do this by yourself as a company? How does that work? Do you have any idea?
I don't know. The good thing, though, is that all this stuff is public now. So they have public hearings. You can hear all the things. You get to hear all the justifications. And I think that's one of the things that Point has going for them is they see how the L code was calculated, and they can come in and say, hey, it's not really the way that this should be calculated. And so at least they have a data point that says this is how it's calculated, and then they can just help maybe them understand that is not a great way to calculate it.
Yeah, but also talking about like that's a good thing on the one hand. On the other hand, it's also it's a hidden negative thing, which is also the reason why no one calls you and tells you why you didn't get the interview if you get a job interview now, or no one tells you why you didn't win the deal, because it opens them up to maybe lawsuits and maybe other sorts of things if they motivate a certain decision behind it. So they may actually kind of now come up with fake ones in order to not get trapped on other ones that are more problematic,
Yeah, well, I think that's an interesting point is, it is in their best interests, like the insurance company, to have the least amount of codes possible. Like the amount of work that it takes to bring a code to fruition. Yes, it's a lot of work on Point Design side, but this team that has to get together and look at all this stuff and mountains of stuff, like I do not envy them at all. So they and all these companies, they are looking to make money, right? So it's a really hard position to be put in if you are an insurer and you're looking at some of this stuff and you're looking at potentially the risk and such and utilization of some of these. I would think you would want to try to be fair, and you would want to try to make it as difficult of a process as possible to make sure that the people that are getting codes are the right people. And so you're not getting these, like what you kind of called these fake codes and such. And so, when you look at these Ethnocare side of things, the other thing that was already interesting about that is they look at distributor pricing, any suppliers that brought in bulk, any lowest cost pricing from a specific period. And when they look at that, they are looking at wholesale. They're not looking at MSRP at all. And that's difficult. And so that's the other thing there are some other ways to get similar performance, like the socks. You have gel inserts, air bladders, some volume pads, other lower cost items. And so I think Medicare kind of, on the Ethnocare side of things, instead of like a prosthetic, say, interface component or something to that effect, they're actually saying this is more of an accessory. It's not really part of a prosthesis. And I think that is also difficult.
Now, there's also that comfort thing where it's like, oh, it's comfort. We won't do anything with that. We've encountered that before, and it's really weird. If you have something where somebody's walking on it every day, it's like, yes, that is a part of the equation. Actually, imagine being uncomfortable every day, every step you take. That's crazy to not care about that.
Yeah, but you take a look. So I think that's an interesting point. And we've had Click Medical on, who had a very favorable reimbursement on their adjustability. And they were able to prove that, hey, this style of fabrication with the strings and the dials and all that stuff does improve comfort and potentially decreases the need for, say, a replacement socket that could be overused, right? So if you are able to put some adjustability in a socket and not have to remake a prosthesis because somebody shrank, that's a big benefit. And I think Medicare really looked at that in a favorable light. And I think it was the absolute right thing to do. It was different enough. And they had a bunch of data, like years and years worth of data, 10 plus years worth of data, a lot of utilization and such. So, in that case, it worked out really well.
It's interesting because it would be interesting if Medicare, for example, said, hey, guys, we're paying a lot of money for this, or we have a lot of these devices that break, if they would take that data that they have, or the insurers have, and say, you know what, we're paying for a lot of whatever these types of sockets and they're breaking. A more durable version of this socket would actually save us money, so we'd love to have that, Or even like a price target. Like if they would say to the market, like, hey, a more durable socket of this type, if it lasted, X months longer, could be $100 more expensive or something like that, If they would really kind of like do it more as a kind of like a kind of really a task-based, or kind of like as a market would work, they would send like kind of demand signals to people and say, wow, we're noticing a lot of these cases and there's no product for it, right? Based upon that system, this is what we would be willing to pay for a product like that. And then you could in advance kind of like, of course they can't pre-approve you, if you will, but as if you met these and these targets and that price target, that maybe then you would be having a really profitable product,
Yeah.
And that could be really interesting if they did it more in a market kind of way. But if you kind of don't know in advance if this thing is actually going to, get money later on, that's a really problematic, also from an investment point of view, or also from just an entrepreneurial point of view, just like, hey, am I going to spend 7 years of my life on this?
Right. Yeah, because I think that's an interesting point. From an investor point of view, it's you take a look and you say, okay, so many people are living with this situation. If we get so many of this, then, we get this much money or what have you. And so but the flip side of that is the risk of not being able to get insurances to cover it. Now, one thing I will say though, is that is on the Medicare side of things. Private insurances, as well as, say, workers' compensation, which people that get hurt on the job, or the Veterans Administration is always a good option too, because they are outside of the L code system.
And if do they follow each other, kind of look at each other, or is that a completely different process?
So they may look at each other, but they do have different rules. And while L codes are used, some of the pricing, I would say, would be more fluid, and you have the ability to use these miscellaneous codes and get paid for them.
All right. Okay, so it's a kind of hiccup. I hope they can appeal or something. I get a little bit more money for what they call. what they need. Yeah, it would be good if they could find a way to convince people that this is, more necessary or deserves somehow more cash from the collective system, let's say. Yeah, that's an interesting look into that. I think we should look at some more people who are more expert in this stuff again, at how this actually works,
Yeah. Yeah. I mean,
either on the
I would
bad
definitely,
side or good side,
Yeah. I would definitely love to do that. Here's the crazy side of that aspect is many of those people, it's such a small, when you take a look at the funnel aspect for Medicare, there's really not a lot of people. I mean, I would say that there's probably from at least my basic amount of research, there's probably less than 20 people that are making this decision. And that is
Wow.
scary, right? Because
Yeah.
20 humans,
We should
but
get them to
if
listen
it
to our
gets,
podcast.
what's that?
We should get them to listen to our podcast.
I know. And
Yeah.
but I think this is where I think you have a good understanding, my side, because I'm a clinician, it's always like they're the bad guys. And I appreciate your perspective of like, hey, they're not necessarily the bad guys. They are watching out for, potential fraud or overutilization, making sure things are fair, making sure that prices are kept in check, that sort of thing. And I see that perspective too. And I do not envy any of theirs. So if they are listening, yes, I'd love to have them on and have them share maybe some of their perspectives on where we miss the boat as a field. But that's the other problem with our field. And I think you've said this before. We have so many, like, we're a very small field, but we have so many organizations that don't even talk to each other. We have the Academy, we have the American Orthotic Prosthetic Association, we have our certifying body, we have NCOPE, we have the National Prosthetic Alliance or something, and all these different organizations, and it's like we can't all pull in the same direction. And for the small amount of people that we have in the field, I've talked to multiple other people that are in much bigger fields, and they're like, what are you guys doing? Like, we have one organization, maybe with some subcommittees or something, and you guys literally have organizations upon organizations for not a lot of people. And it's a really tough predicament to be in for something like this.
Yeah, totally. It makes it really complicated. And you got all these little empires and stuff. And that's never really very good. And I think, in additive, we've seen more broadly, for example, the FDA has been super proactive with 3D printing generally and super open as well. And has really tried to communicate to give off the right signals and tell people like, hey, custom devices for in the body, we're not a fan, other stuff like, there's ways that we're super, super open or we really want to be the regulatory body for this, So, my own experience has been very, very positive in that sense. So it's been shaped by that. They come to our conferences, but AMS, a bunch of FDA people come all the time and, they're calling for our show in New York they just really actually want to be there to listen to people, to talk to people, to interact, and to really go and find out, what's happening on the ground. So I've been really very pleasantly surprised. So that's colored my own kind of experience as well.
Well, and I think that's a really good point. I mean, I forget when it was this year, the Medicare said, hey, 3D printing is a viable way to make a prosthesis. It's super forward thinking. And I can appreciate, so there are some people that are like, well, 3D printing needs its own code. And we always get back to the same point as like, yes, there are advantages to 3D printing, but does it really warrant its own code? Or is it just truly another way to manufacture? And I would say I'm in the camp of there are benefits, but there are a lot of descriptions in the L code side of things that describe what we're trying to do with additive manufacturing. So like, I really appreciate Medicare coming and saying, hey, 3D printing is a valid way of manufacturing, full stop. And my hope is that there is enough camaraderie and groups pulling in the same direction that we don't rock that boat. Oh, I want to do resin printing, or I want to do powder printing, or whatever, and I want my product to be in this, and I want an L code because I'm 3D printing this. I just don't think that's the right way to go. And this is my opinion. I think that 3D printing allows us to scale, and the fact that they have outlined it as a true manufacturing alternative is enough for me.
Okay. All right.
What do you think of that?
Interesting.
Is that not a good perspective?
No, it's a different way of looking at it. I don't know. It's good to be ambitious generally. And it's good to, they also don't know what they're doing. No one knows what they're doing. That's the problem. In the face of this, no one knows what they're doing. So it's how do you grapple with that uncertainty and how you grapple with the future,
Would you say though that, would you agree with the statement that additive manufacturing is just a different manufacturing technique to make a prosthesis?
Yeah. Okay. So okay. All right. My perspective always has been to not make any specific additive rules, because I come from we did a lot of the gun stuff, and the lot of the debate around guns and 3D printing guns, and people were printing guns at home, all that kind of stuff. And there you saw local legislatures make specific rules, like you can't 3D print a gun, right? Where, well, you could make a gun out of clay either, or CNC or lathe, right? But they were making special rules for 3D printing, which kind of I thought was like kind of like really confusing and unnecessary, and made it more difficult, right? Or made it more difficult to print just everyday stuff, whereas it doesn't actually necessarily make it more difficult to make a 3D printed gun. And so that's where I come from, where I always see like people make special rules for this, right? So on the one hand, that's my background. On the other hand, it's like, if it's a production technology, we have to realize we can make geometries in very different ways, and these processes are very different. And so getting blanket approval for all of them in kind of a general use is maybe also not like the optimal solution. Yeah, you can use this, but you could also use clay. I mean, I'm not saying that clay is going to be a normal method for most people, but you could use clay. All right. It's about, ultimately for me, it's like about like, what is the final device and how does it perform? I don't want to like kind of at one point be locked into having to do it a certain way, or not being able to do it, or for, one process to not work or work. Does that make sense?
Yeah.
Sense?
Well, I think you hit the nail on the head. Like, why try to put limits? They came out and said 3D printing is a viable technology. You know what that means? I can use resin. I can use FDM. I can use powder. I can use metal. I can use stuff that's coming out. I can use rapid liquid print. All this stuff, it's viable. Like, I think having it super broad has been one of the greatest gifts to our field, and we have to just think beyond ourselves and look towards the future too. And if we start trying to get into the minutia, they might start locking it down.
Yeah, exactly. Or it could already be kind of so well defined before we understand what we can do with it. Like, for example, now metal printing, on the point design example, LPBF is very expensive, right? The machine's $3 million. If you get a one-click machine, it's $150K. But there's a Chinese machine we talk about a little bit at Formnext, which was $20K. I wouldn't like to have it at my house or anything. This could get much cheaper, right? So maybe you could use that for like a much different prosthetic than before, or larger things, braces, I don't know, right? So it's like the technology is developing quite quickly. Inkjet right now isn't used for almost anything, but inkjet is changing so quickly that it could be used for very functional parts very soon. SLA, we've talked about this before privately, where we're both very uncomfortable with SLA or VAT polymerization because of the way it shatters very quickly and it catastrophically breaks. So then it's not, it's not a great solution generally, even though it makes really really nice looking parts. It's great for molds. But on the same hand, well, they're improving the strength of these materials all the time in the prints. So it's like it's in transition. So to say kind of yes or no, or to say I took that as a kind of like innovate faster, please kind of thing, that's what I think they were saying with this. It's a suitable technology, and I think that they also realize that like we don't really know how far this will go. We see, for example, companies come up with like low temperature peak and like your PK 5000 material and stuff, where all of a sudden with polymer you're able to do so much more than we were like only 2-3 years ago. And also, like, think about it, like 5 years ago, I think we both would have been if somebody would have come to us and say, hey, I want to start a print farm to print, well, even like orthoses or something, we would have been like, well, it could work, right? But hey, TPU is slow and the machines break a lot and everything. But now that it's going so quickly, that's if someone would come to us, I want to make orthoses, we were like, yeah, you should start a print farm,
Right.
And that's a really big difference to a lot of people. And it's a really big difference in determining what can be made when for how much, So I don't know. I think that we're going to have a lot more discussions about this, and I think I hope we get a lot more better results. But I think generally, I think the future's still quite bright.
Yeah,
I think.
Well, speaking of bright,
Yeah.
How about that transition?
Okay, I like it. Good.
let's-
We could be on local news, dude. Over to you, Brock.
let's talk about, we're finishing up the season. This is going to be a bonus episode for the end of this year. We've got a lot of things going on, and this has been wild. We're over, I think it's over 3 years into this.
Doesn't feel like.
No, this will be the 145th episode. How crazy is that? Or it might actually be more than that, because I know we've thrown in a couple bonus episodes before this. I mean, we're still learning stuff every time we do this, and I think it's so great. And we're not, I know both you and I agreed, hey, when this started being not fun, then we just need to stop. And we haven't stopped yet. And I don't foresee that coming here. And we are learning so much. What, over the last year, I mean, what do you think, what is say, 2 takeaways that you have kind of learned over the many episodes that we've done, whether big ideas or an episode that you really remember?
The big ideas for additive thing is that the desktop 3D printing thing, which in the beginning, like if you're talking about 12 months, the beginning of 12 months saw us, you were already very excited about Bamboo a couple of years ago. I was as well. But now we saw that kind of broaden, and we saw like the desktop machine, the rise of the desktop machine. I think for me, generally in additive, that's been the story for the last 12 months. And the rise of the desktop machine in farms and production and end use parts, in like things like you going to Guatemala and taking these really super cheap printers with you, and it works, right? So the desktop 3D printing revolution may actually happen after all, kind of, 5 years too late, 10 years too late, but it's still going to happen maybe. Or it may actually happen, but for certain sectors of the business. So that's my overlying, like, great big, like, learning that I'm really excited about going into the new year. And we're going to 5 million systems a year to maybe like around 10 million. And that's huge. Right. If we look at how we're doing, a million systems only like 4 or 5 years ago. And so that's the thing. On the prosthetics thing, I think on the one hand, it's like the downside thing, or the negative thing is like how, even though we're trying to let people learn along with us, and also we're learning ourselves, right? So it's not like we know everything. We're doing it specifically because we do a lot. So we specifically know very little, so we're trying to figure this out for ourselves. And we want everybody to learn as we learn, right? And across that journey, I think it's still very, very surprising to me how a lot of process-specific knowledge and a lot of, for prosthetics, orthotics and prosthetics specific, is just locked away in people's minds, and it's still very in the realm of an artisan, right? Yeah. Where it's still like somebody really specific has some really specific knowledge and really specific way of doing things, so much as a craft still. And on the one hand, I really want us to really think, if we're going forward, is like, how do we preserve that in that going forward? Is it becoming like a digital artisanship thing? Is it going to be a culmination? Because I think that personalized nature of that inventiveness, right, is going to be the soul of this business. Has always been the soul of this business. If we see about the people we talk to in the show, it's always very, very different. And they always kind of, almost all of them start with this really random story. Like, well, I was meant to be an ice cream, but, and they always end up being, or they've been doing this for 3 generations.
Right.
So it's either really random, or it's like 3 generations of doing this. And there are always these people that like to do a whole bunch of different things and invent things and make things and craft things and work with people. And then for them, it's this really perfect kind of combination, right? And so to me, that's the soul of this business. I think maintaining that, and maintaining that level of customization and that personal touch in that coming 12 months is going to be the really defining thing for me. Because the other thing I see looming beyond that is in everything we've discussed with these workflows, right? AI-based or deterministic workflows, outsourcing to ever larger CFABs, maybe CFABs in different countries. Maybe I only do the scanning, somebody else does all the work on the device. It's going to become a lot more automated, and it's going to become a lot more less personal, right? And that could mean that maybe you're the better processist and stuff, and I'm just better at scanning and talking to people, right? And you know what? A lot of people aren't going to know the difference, right? It's like, Auntie Jane will take the wedding photos because whatever, she's so good with Instagram,
Right.
It's that kind of thing. It's not like that she's a better photographer than Sarah, the professional photographer. It's that no one really can tell the difference. And I think that's the worry, right? I have on the one hand, it's going to maybe get a lot more efficient and bigger and more massive. and maybe like, hey, just press a button and the right prosthetic gets made. But on the other hand, that artisanship should at one point kind of get lost, that personal touch.
Yeah. Yeah. For me, I would say I agree with you on the desktop printing. And I think, I'm looking back through these episodes and, we saw a lot of acquisitions this past year. And one of the big one that sticks out is Filament Innovations getting acquired by Proteor, right? So now you've got something that's going to go on more corporate. And, I think the jury's still out. Does that enhance innovation or does it actually stifle innovation? And that was a big one. And I think that there's a big opportunity for smaller companies like, our company, Advanced 3D, with some of the things that we have coming down the pike, because we're going to be able to be more nimble and such when we're making some of these decisions, because it doesn't have to go through a bunch of levels of corporate and all that stuff. However, they're way better funded than we are, right? And so sometimes the dollar bills do make a difference. So I think that's interesting. But you're going to laugh at this. So we love the Bamboo. We have a H2D, the H2S's. I don't have one, but I have a couple people that have them because we bought an H2S or H2D right when the H2S came out. But I would have an H2S because of the Z. So you've got that. You've got Prusa coming out with their stuff. But here is something crazy, and you may laugh. But we have actually implemented 2 Neptune or Elegoo Neptune Max 4s or whatever. Very inexpensive printers. But we upgraded to a Bondtech extruder hot end setup. I bought them on Black Friday.
So now it's gonna like break and look pretty while doing that, or what's the plan?
No, I mean, I know you're laughing because it's like, oh my goodness, what have you done? You have introduced some Chinese stuff into your market, low cost. I'm telling you, these are some of the most beautiful prints that I've seen.
What? No. Okay, wait. Now I'm gonna go on myself. Okay, wait. Which one?
The Elegoo Neptune 4 Max or Plus.
That's the Creality 3 kind of, or the ANET, for TPU.
So we put this Bondtech extruder on. So Bondtech makes a upgrade kit, and we didn't even try with the Neptune stuff, which maybe we shouldn't have done that, but we actually run this extruder on another machine, and we're like, this does TPU really nice. And I'm telling you, it is. So I bought everything on Black Friday, and for 2 of those printers and the Bondtech upgrade, I don't even think I was into it for $1,000.
All right. I think this is interesting. In the competitive landscape thing, I think a lot of people are just screwed. Bamboo is just better at the software and better at the experience and really great making a system. But the one thing where they're weak is TPU, and they've always been weak at TPU. And with a large-scale printer like that, I didn't know about this one working well. I'm not real big Elegoo fan, by the way. Apart from the SLA stuff they do is okay. It's like, if you want something for $200, it kind of works. It's fine. But I'm not a really big fan of the FDM systems. And I'm much more likely to, in that price category and that same type of that larger Max MK3S kind of, I would much rather take like a artillery or ANET even if I'm not dead yet. So I think it's interesting, but I think that's just an interesting choice is going forward is like, it looks like Bamboo is kind of all conquering, but hey, but there's also Snapmaker, there's also Creality. And I think on a TPU front, we could be seeing some interesting things if these guys decide to make like a $500 printer specifically for prosthetics or something like that. So these guys have very little space to go, but I'm pretty sure these big kind of simple printers do tend to work really well for TPU. So that could be really interesting, I think.
Yeah.
So interesting that you did it. Keep me abreast of this because I'm really interested because I know people that, for example, are working in like fabric, clothing, shoes, and they're kind of tending to stick with this kind of the same architecture you went with, the big MK S2 kind of model, S3 type model.
Mm-hmm.
And that's working out well for a lot of these people. And they're not upgraded. These are the only people I know that aren't upgrading to like the more K1, K2 Bamboo H2D systems. So that could be really interesting to see if that would actually work. And the other thing, which is I think is also really interesting, is what Recreos has done.
Yes.
All right. And they've just introduced, and I still don't know, I need to test it, but I just don't want, I don't have the time at the moment, but I want to. And they've just introduced a 2.2 millimeter kind of filament standard, essentially. And they're saying that this makes a lot more sense and can actually lead to them printing more reliably, more repeatably. I have no idea if it's true. I know Recre has a long time. They're, Spanish-based, one of the leaders, innovators in this TPU filament stuff. And so they've been making quite good products for a really long time now, but I haven't tested it yet myself. But the idea of them saying, you know what, for TPU specifically, we're going to come up with this 2.2 millimeters filament. You have a little kit that you can buy, and then you can transition to the new filament. The kit seems like it's going to be quite interesting and to implement, not going to be crazy expensive. And then they said it's much more higher reliability, repeatability, and maybe even speed as well on TPU. So that could be in and of itself. That's the single innovation I'm looking for the most in the next year, is what platform is going to be the default platform for printing a TPU and other elastomeric materials for the desktop for prosthetics, orthotics especially, I think, because that could be huge. And is it going to work? Is this right? Because it seems like a crazy idea. Oh, guys, we should use a third filament standard. It's like, what? No, go away. I don't want that, But if you're going to be printing like these insoles all day, every day, and the material's not that expensive, then yeah, I don't think you would really care, right?
Yeah. Well, and here's the thing that I learned, and we had Grant Michael on. I mean, it's been a little while ago, and he had a saying that stayed with me. If you can print slow, print slow. Like, why do you have to print fast? And so I think that's kind of the approach that we've taken with these is, hey, it's still going to be faster than me outsourcing to somebody that has a multi-jet fusion printer. And we're actually getting properties as good or better than multi-jet fusion TPU, which is crazy. And so,
well, it's not, but we've determined already that I think for a lot of these parts, it's if it's low and slow and the track width is good, it's the basically material extrusion is probably the way to go. And also then there's also cost limit and there's also the ability to change infill as well. Whereas in the MGF thing, you only have your lattices to really kind of significantly influence geometry. So I think we already had this discussion, I think.
Yeah.
In the beginning, where you were also saying that, like, hey, for certain things, like, material extrusion is totally going to win. I think I totally agree with you on. I think for anything lower, like higher up in the body, the higher up in the body you go, maybe the more MGF-y it gets. The lower you get in the body, the more material extrusion it gets.
Yeah, interesting. Yeah, and so then so that was I think that's probably the interesting thing for me is these lower cost desktop units are actually very, very good. And if you're not trying to break land speed records for printing with TPU, then this might be a good option. And then the other thing, and you touched on it, is this idea of workflow, automation. How can you raise the water level for everybody so they get access to a well thought out, clinically validated, quote unquote, validated device? And I think, Fred kind of exposed some of that on our last episode was, hey, you can be very intentional on how you design this one thing. And you can also then use that to design your next thing and your next thing and your next thing, saving time learning along the way. And then we had Johann Weigel from Stuttgart talking about his AirFit system, where it's manual, so it's not just taking a scan of somebody's leg, but it's what you do with that. So it's true load bearing. What does the tissue do under load? And then you scan that and you can automate it from there, and you barely have to touch it. And you probably, I don't know if you listened to the episode what I did with David Slider. So
No, I didn't actually. I should.
So we did that. So David Slider came in Sunday night. He's a very active below the knee amputee. He came in Sunday night. I put him in the AirFit. We scanned that. I modified, sent it to the printer that night. And the next day by noon, he was walking in his final socket. And typically you go through an iteration like a test socket and all that, but I called it full send. So we went full send to the final socket and we did pretty well. There were a couple adjustments that I probably want to make just because there were some things that he was a new patient to me. I was new to him as far as on the clinical side. So there were some things that, might have been some assumptions on both of our parts that didn't get the exact result that we wanted, but he was walking and we were able to actually complete a walking study in a full-on motion capture lab that was able to compare his current prosthesis to the prosthesis that we made, and it was really, really neat. And so we're supposed to find the data of that very soon. But that was really the power of 3D printing and this idea of, hey, we're going to use these tools like this pump method using a paddleboard pump to get the shape and digitize that and move on, because there's not a lot of work that has to be done on the backside of that.
I thought that what I liked about the airfit thing, you've been a big fan of that and you use it and stuff. And what I thought was interesting is that we've always looked at like, how is there going to be a better scanner, or is it going to be a handheld scanner, or is it going to be, whatever, right? And I think this is interesting that you see innovation like this, where it's kind of very left field stuff, Oh, I didn't think of that, and that kind of stuff could really, really change things. It really disrupts stuff as well. So I hope we see more of that, where maybe this just looks, I don't know if it's like, it looks inexpensive. I have no idea if it's expensive or not, but it does not seem like a very expensive solution, right?
Yeah. Yeah, I mean, I think that's one of those things. Hopefully, the costs and such will come down. It is an expensive solution to make, because you do not want this thing to explode under pressure.
Okay.
So there's a manufacturing stuff that has to go into that, which is not inexpensive to do and validate. So, but if there's a greater volume and we can help do that better, then I think that's going to be a real positive thing. But I agree with you. It's like, okay, so we've talked about AI and all this stuff, but what if the answer is something that's hybrid? You do something like this that's very manual, and then you go and you use a scanner and quickly use automation after that to make the socket.
Yeah, exactly. So that could be really cool. I hope we see more stuff like that. That would be really cool. And I hope we just talk to lots more people. I think I'm still enjoying the people, and still very different personalities, very different backgrounds. They'll have that kind of tinkerish, inventor, craftiness in common, but still really enjoying doing this. Really happy we're doing this. So awesome.
Yeah, 100%. It's been fun. And so, yeah, to all our listeners, thank you for listening. We actually, I just checked the stats here. We were up to 118 countries, over 3,200 cities, and we're going to be crossing the 35,000 listener mark very, very soon, which is pretty wild for a small kind of a niche podcast.
Well, totally. And I'm still learning, and I hope our listeners are learning as well. And I think that's the ultimate thing for me. That's the ultimate kind of way to keep score there. I mean, love that so many people are listening, but also just as long as we're learning and having fun doing this, and I'm super happy doing this forever and ever and ever. And yeah, so thanks a lot, Brent, for this, and thank you guys for listening to the Prosthetics and Orthotics podcast.